Vein disorders can come in different shapes and different levels of severity. I think that some people live with pain and swelling under the assumption that vein disorders might be considered cosmetic. That isn't true. Anything that is varicose, and by varicose I mean the vein bulges out of the skin, means that there's leaky valves in the vein system, and often what you see on the surface is only the tip of the iceberg, that the veins, the deeper veins, also have problems, often much larger problems, that only an detailed ultrasound exam could uncover. The Mission Heritage Vein Center is a comprehensive, specialized institution that diagnoses, assesses, and treats vein disorders of all severities, ranging from mild to severe. We have our physicians who are cardiologists who are trained in vascular disease, and we have technicians, vascular technicians, who are experts at doing the ultrasound tests that can diagnose where the problem is in the vascular system, specifically in the vein system. That vein ultrasound performed by the vascular technologists is a pretty key part of our assessment of the patient, because it's basically our roadmap on how to treat the patient. Our team works very well together because we have a culture of really caring for the patient and meeting their needs and treating them like they are a member of our family. I find that the more I explain to patients how the vascular system or the vein system works, it's not so much of an unknown anymore. They sort of understand what's happening and the ways that we can treat them, which usually there's a spectrum of a conservative way, a more aggressive or invasive way, and I explain all these to them and let them come to choose which way is going to work for them. I think every time I meet a patient, I learn something new from them in the way that the disease affects them and in the way that they process it and the way that they choose to deal with it or resolve it. And I think my job is to be an advocate for them and a facilitator for them to achieve what they want and in the way that they want. The majority of our patients are women. There are plenty of men, there are plenty of young patients, there are plenty of elderly patients, but the majority of our patients are women in the age groups 40 to 55. Providence is an outstanding organization because it's got a lot of depth to it. We're not a standalone vein center. We've got a gigantic group behind us with multi-specialty capabilities, not only in physicians, but in our laboratory and our diagnostic labs. My hope for patients who come to our vein center is that they receive cutting-edge, state-of-the-art treatment, counseling, education, and leave with a satisfaction that they are very knowledgeable now about their vein disorder and have the option to choose whatever treatment they're most comfortable with the knowledge that the treatment they get is going to be top-notch.